good afternoon. My name is Kristen Rosenberger, and I'm the Director of Advocacy and External Engagement at Greater Twin Cities United Way. I just want to thank all of you for coming to today's program and also extend an extra special thank you to our donors for your support. Our homes provide a foundation where we center our families and daily lives. So it's really been fun to see all the different places that folks are. Obviously, a lot of people call Minnesota home, but I'm seeing a lot of Midwest. We've got Texas, South Carolina, Ohio, we've got Chicago here. So really fun. Feel free when you jump in to add that. But today we're talking about the important issues of homes, of housing. So today we're going to learn how Minnesotans stay safely housed this winter and year round, which has certainly been a growing issue and concern. We host our Community Connection series events to share the impact, ideas, and opportunities to disrupt inequity and fuel change in our region. So our objective today is to really bring you closer to this work and share deeper conversations on pressing community issues and how United Way is stepping up with its response. So here's how we'll spend the next hour together. First, James Collins, our Director of 211, will talk about the current state of housing and how the pandemic has increased the demand for housing supports and shifted the way services are delivered. We'll hear how United Way leverages insights from our community partners and our 211 helpline to address evolving community needs. And our interconnected efforts collectively work to create lasting change. So a couple examples among many would be, we partner with government on coordinated projects. We often launch new initiatives and innovation. We advance systems change through advocacy, leverage data, as I mentioned before, from our 211 resource helpline and our suicide prevention lifeline. We strengthen relationships with our corporate partners, and we build transformative nonprofit partnerships. And you'll hear from Tamara's start today. One of our very special guests will be engaging in dialogue today. Tamara is a Senior Director of Housing and Youth Development at Tubman. And I also want to welcome Jacky Johnson, who is a Community Resource Specialist with 211. Today, we're going to do something a little different. So you'll have the chance to select a single breakout session to join one of our speakers today, where you can learn more about their work to increase housing stability and prevent homelessness, and just ask questions in a smaller, more dynamic and engaging group setting. Then we'll all come back together to share how their work is leading to positive impact and a hopeful future. So now I'd just like to take a quick moment to provide a land acknowledgement. These are the traditional, ancestral, and contemporary lands of Indigenous peoples. We are on Dakota lands of Minnesota Makoche, or land where the water reflects the sky, or cloudy water. The water, trees, and all living things coming out of the ground carry with them the spirit of the Dakota people, because quite literally this ground is saturated with the DNA of the ancestors who lived here for millennia. The land was ceded from the Dakota in the treaties of 1837 and 1851, and we acknowledge the complex and multi-layered history that included violence and trauma. This land continues to hold great historical and spiritual significance and remains sacred for many people. By offering this land acknowledgement, we affirm tribal sovereignty, and the Greater Twin Cities United Way is committed to ongoing efforts to recognize, support, and advocate for sovereign tribal nations and Indigenous peoples of the state of Minnesota and across the United States. Let's go to the next slide. So now it is my pleasure to introduce to you James Collins. So welcome, James.
Thank you, Kristen, and thank you for having me today and the opportunity to talk about housing. So my name is James Collins. Like Kristen said, I have the privilege of leading our 211 and suicide prevention programs here at Greater Twin Cities United Way. Today's conversation will feature 211 and the work that we do to streamline, expand, promote access to housing services. 211 is a broad-based social services information and referral program really focused on getting people the information they need to access critical community resources, right? So in terms of scope, kind of size of impact, we've got 80 staff right now in 211 with our rent assistance and core 211 work, handling about 1,500 to 2,500 calls every day, right? Every day, 24/7, 365. Today's conversation is particularly focused on housing. 211 answers all sorts of social services questions about every social services need you can imagine. But we know that housing is a particular need that Minnesota has experienced for many years, that has been exacerbated by the COVID pandemic. And then just a quick note of appreciation, the work that we've led in housing, particularly in housing. I'd like to send a quick note of appreciation to our philanthropic supporters who have joined us today. I think Patty's here from the Wells Fargo Foundation, and then our support we received from the Polad Family Foundation and Otto Bremer Trust. Thank you so much. Your generosity is really what helps keep this impact happening. So next slide, please. Thanks. So what do we do, right? What is the work of 211? I said it's broad-based social services information and referral. And what we really do is we build a bridge, right? We build a bridge between someone who reaches out to 211 and connects that person to social services. We know that information can be hard to access, and social services programs are particularly hard to understand, particularly hard to navigate, especially as you're maybe experiencing a crisis, right? So the role that we play, again, that bridge into social services to connect all Minnesotans across our state, we're a statewide program, to resources in their county, in their community, and help open that door to what does exist. How we provide that work? So like I said, we've got a team of currently about 80 staff on our 211 team, responding to those 2,500 calls a day, providing information, referrals, assistance. But I would also say is our specialists provide a human-to-human interaction, right? So many of us are walking around with a computer in our pocket. We can pull that out and start to Google things, but you'll quickly realize that websites aren't updated. Even if you can find an updated website, it might not clearly walk you through the eligibility criteria for certain assistance programs. It will be hard to communicate, right? You can't have that conversation with a website to say, this is my situation, this is my experience, help me understand if this is the program that's right for me. And then who do I talk to, right? Who do I get in touch with? And can you help me get in touch, right? So in our conversations later today, we'll talk about how that conversation happens, the assistance, the information, the referral that's provided, and we'll touch on some of the partnerships that we engage in to not only on the front end as people are seeking information, but kind of on that back end. Many of these programs, right, are structured in a way, structured around scarcity. And what that means is that they're built to prioritize, they're built to keep people out, they're built to not necessarily with that user in mind, with that client in mind. They're built around the funds available, right? And so our team does increasingly a lot of work on building partnerships to decrease those barriers, help ease access, streamline access, and promote understanding. And then why do we do this? Particularly why do we do this in housing? You know, across all of Greater Twin Cities, United Way's work in housing, whether it's grant making, field building, capacity building, the advocacy work that Kristen Rosenberger leads, or 211, right? We do that. That work is rooted in the Interagency Council on Homelessness belief, right? This kind of shared nationwide commitment around that homelessness should be prevented whenever possible. And when it's not possible, that episodes of homelessness are rare, brief, and non-recurring. So what that means and why that's important is, you know, we do our best to prevent homelessness, meaning keep someone in their home, prevent eviction, keep them stably housed in place whenever we can, right? We know that that is by far the best approach. And then when it does occur, make sure that it doesn't happen more than once, that it's short, and that is really where the work of our partners at Tubman and across the Twin Cities will be brought to life. Next slide, please, Jasmine. And then in terms of, creating connections into housing, I get asked all the time, James, 211, you say it's broad-based social services information referral. I say, yes, it is, right? You can ask us all sorts of questions. And then the follow-up question is, but you talk about housing all the time. Well, housing, of our 480,000 plus requests last year, housing made up 60% of those requests. Why is that? It's because housing programs, like I said in the previous slide, are difficult to navigate. Housing programs are difficult to understand. Housing programs are often built around scarcity. Housing programs are built to keep people out. And Minnesota is experiencing a housing crisis, a lack of affordable housing, a lack of available shelter beds, a lack of ability of Minnesotans to pay their rent. And so all of that comes together really with that realization of rent is expensive, a mortgage payment is expensive. It's probably going to be the most expensive item on a household's budget. And so navigating that, you'll see of those 60% of our requests, right, that are housing related, if we break that down, I think this often people jump to, we think homelessness. Well, of the housing related requests we receive, we see that 60% of those, again, that's kind of our key percentage today, I guess. 60% of those are focused on rent assistance, or really that conversation around, I have a place to live. How can I maintain that place to live? How can I prevent myself from becoming homeless, right? 20% of those focus on utility assistance. Utility assistance, you might say that's not housing. Well, actually, if your utilities are disconnected, that can lead to eviction, right? So we all know that Minnesota winters are cold. It's not quite as cold today, but we know that Minnesota winters are cold, and utility costs are increasing. All the more important to focus on utility assistance, and that really does drive a lot of our calls. And then people are often surprised to see that of our housing related requests, only 10%, and again, not to minimize, because it's very important, but 10% are questions around shelter or not having a place to sleep tonight, right? Or not having a place to sleep tomorrow night. And that is the other 10% is kind of all other housing requests. But this really provides an overview for what we hear and why over the past couple of years we have really leaned into homelessness prevention, right? Because rooted in that concept that an eviction, right, preventing homelessness is really the key way to end homelessness, right? So what we'll do now is we're going to start bringing this work to life. So Jasmine, next slide, please. So we've got in this the opportunity to break out into breakout rooms and really dive deep into the experience of 211. So Jacky Johnson is one of our 211 community resource specialists, and Jacky will be partnered with Julie Ogoulier, our program officer for 211. And in this breakout room, they will take you through the experience of calling 211, discussing a housing need, and what that information referral assistance process looks like. You can also pose questions to Jacky about the calls she gets, how we support our callers and get them the information needed to make a successful referral. And then a second, Jay Wagner, our housing program officer, will lead a conversation with Tamara Stark, the Senior Director of Housing and Youth Development at Tubman, one of our incredible nonprofit partners. doing important work here in the Twin Cities, working directly with families experiencing housing instability. And so what we'll do is really, again, to bring this work to life, break out into this, and I hope you've come ready with some questions.
Thank you all so much. My name is Tamara Stark and I work at Tubman. We're a community-based agency working in partnership to end and prevent violence, discrimination, homelessness, and we provide a range of resources in the community for all ages, backgrounds, and genders. We're able to do this because of dedicated staff, volunteers, and community members who are just so committed to building caring and equitable communities. We also work in collaboration across differences so that everyone can thrive. Our work is made all the better, of course, by the people we serve who possess amazing expertise, insights, vision, and leadership rooted in lived experiences.
Yeah, well, that's a huge amount of work. It's so important. And so those of you that want to talk with Tamara a little bit more, make sure you choose breakout number 2. And then Jacky, welcome to you. If you could just give us a quick introduction, we would love to. I'll meet you as well.
Okay. I'm a community resource specialist at 211. James has kind of prepped what we do. But I'm on the phones with people. So I'm talking with people, I'm hearing their stories, finding out their situation, trying to connect them to the right resources and provide, information on navigating the systems. So that's pretty much what we do. I've been doing it for almost 12 years now. And it's great to be able to help people.
Yeah.
And it's a team effort, everybody works together, our resource staff keeps the database updated. So we work well as a team.
Yeah, and I think that's important that, and I think as you mentioned now, and James also, that we're really being able to connect people to current resources that are available. Those can change on a daily basis. So that's actually really, really critical.
My name is Julie Ogunle. I'm the Senior Program Officer for 211 and get to work closely with Jacky and her team on the phones, and as well as a lot of our great partners in the community. So thank you for the time. So one of the things that we know that the pandemic especially created a whole new set of challenges in our community. Housing, long before the pandemic, was one of the #1 reasons that people call 211 and has only become more dominant or predominant. And so Jacky, can you say a little bit more about kind of how those needs maybe have changed over the last 18 months or 2 years? Gosh, we're getting to 24 months now. How some of those kind of conversations and needs of people that reach out to 211, how has that evolved over these last few years?
Well, prior to the pandemic and also during, a lot of the callers that we have, they're already familiar with social services or government benefit programs. So they kind of know the jargon, they kind of know the process, but maybe they've lost the phone number, so we try to help them with that. During the pandemic, we have had many more people calling that have never had to access social services. So they basically don't know where to start. And they're calling us to find out, how do I get help? I need help with rent or the mortgage. I need help with utility bills. I need help getting food. I need, all the basic kind of needs. There's no longer a 2-income household maybe. So they're reduced for what they can afford to do, struggling with all these things. So, we help to point them in the right direction, kind of help guide them through the system, explain the processes. And the system is complex. It's not just one call. You might be making calls to multiple agencies to try to get that help. But that's the most common need, as James has already said, is the housing, and then help with paying bills, utility bills especially. So.
Yeah, great. Thank you, Jacky, for sharing that information. And how we know that, again, housing is it is a complex system and it's a big need in our community, but what challenges do you see come up in conversation? What barriers are people facing when they try to secure housing? What is preventing stable housing in some cases?
Well, there are, of course, a variety of things that are going on. So people may be, they've lost a job or had reduced hours due to the pandemic. So they're needing help with like past month's rent or mortgage. So that's a huge challenge for people. You know, somebody might be having to move, like their lease was not renewed and they need to move. But they need help with the first month's rent and deposit because that's expensive. And, a lot of these people, they're not going to have that cash ready to do that, especially if they've, lost a job kind of thing. But they might also have a bad credit rating. Maybe they have an eviction on their record. There's a criminal history. Those are all barriers to finding housing. We all know that there is a lack of affordable housing. But some things can be as simple as needing an ID or a birth certificate for their children, because programs will require certain documentation. And if they've lost that documentation and they can't afford to get it back, it's a barrier to get into housing or even to potentially get into shelters.
Yeah, thank you. We do have a question in the chat that I'd like to pose in terms of kind of prioritization for some of these programs. I know we have different counties might have different rules, or depending where you live across the state. But for example, if somebody is sleeping in their car, is that perhaps prioritized to a greater degree, or how is that? How is each kind of situation taken into account when providing resources?
Well, as far as 211, we work with that caller to say, what's your highest priority? So if they are living in a car, obviously you want to try to get them into some kind of shelter. If they're not interested in shelter, then you explore other options with them and see like where they're at, what they can do. Do they have family they can stay with? That's not a possibility. What other options might be out there? And quite frankly, sometimes there aren't any. Or you have someone who has a pet and they don't want to go into shelter. So, you try to work with people where they're at. As far as prioritization with other agencies, like if they're going through a coordinated entry process, there can be a prioritization depending on what that caller's situation is. So I know with like Ramsey County Coordinated Access for Families with Minor Children, that if someone is staying in a car, they do have to provide documentation of that, like through a pastor or a social worker or something like that. That can move them up in the priority list to find transitional or supportive housing.
Mm-hmm. Yeah, I think that's a really important point that, these programs often they're not first come, first serve. It's not you've got on the waiting list and now your turn will be up. It is prioritized, especially in those coordinated entry systems. So you will need to meet a certain threshold of, more greater need or more hardship to even qualify for some of those programs.
Yeah.
Mm-hmm.
But even if your priority is up due to the fact that there isn't enough affordable housing around, they could still be on a waiting list.
Mm-hmm.
I mean, we might call it emergency housing or emergency shelter, but the truth is there's not enough shelter space for everybody who needs it. So it doesn't mean you're going to get into shelter immediately.
Mm-hmm. Yeah. So one thing that I want to touch on too is, so during the pandemic, there's been additional resources through Rent Help Minnesota for rent assistance and utility assistance. Can you say more about how 211 has played a role in helping families access some of those funds?
Well, with the calls for rent or mortgage payments, that's significantly increased during the pandemic here. There's been a lot of questions about the eviction moratorium or how does forbearance work. That forbearance process usually has a lot of people, they've already tried that. So now they're looking for other ways to get help so they can keep their housing. But then there are also federal programs. There was the CHAP program, and now the Rent Help MN program, which has also increased the number of calls that 211 has taken, because people listen to the phone tree, but they're not sure what button to press. So they get through to us and we kind of assess their needs again and make sure that, do they need to be transferred over to there, or is there something else we can help them, plus transferring them over. So it has significantly increased the number of calls that we handle.
Yeah. And just to clarify too, when you say transfer over,
Okay. Right.
Yeah. Do you want to elaborate a bit?
Sure. Well, we have, they kind of call us the core team that handles all the calls for 211. But we have this Rent Help MN team, and we have a special team that handles those calls. So we transferred them over to them, and they can help them determine eligibility, help them with the process, kind of explain things if they're having trouble uploading documentation, that kind of thing.
Yes. So we've been fortunate in Minnesota to have the emergency rental assistance program to help with some of those that increased need for rental assistance, specifically due to the pandemic. James, I know you are on this breakout. Do you want to pop in, if you don't mind, to speak maybe to some of the financial help for programs and how some of these programs are funded, if you wouldn't mind?
Sure. Yeah. So where does the question is, where does financial help for these programs come from? In these housing programs, it really comes from all levels of government. Depending on where you live, a lot of organizations will blend and braid different federal, state, and local resources to stand up housing programs, as well as augment that with philanthropic funds, right? So to try to plug the gaps or fill in the gaps. So often the work of Jacky and others in our team is to point folks towards the existing public programs. And then occasionally, right, there may be programs that kind of over the top or supplement the state and county programs. Hopefully that meant that.
Well, and I think that makes it as clear as mud, because it is a patchwork system. It comes from all these different pockets, and different programs even have different funding sources. So even if it's one agency, they might be getting federal, state, county, private donation dollars. And so based on any criteria that come along with those programs or eligibility requirements, they might, creatively help match somebody within their organization to that funding source. But I think it is a complex system that we're all navigating. So thank you. And Jacky, maybe this is a good time to kind of give a walkthrough maybe of, so somebody calls you to look for help with housing. How does that conversation go, and what is that interaction like?
Well, when people call, lots of times they'll kind of tell you a bit about their situation, so you kind of get an idea of their story and what they're going through. And then you'd ask clarifying questions to kind of go, okay, where do we need to go? What's the priority here? Maybe they're calling and they just say, I need help with bills. And you're like, okay, so tell me what bills you need. And we'll start with the first one and go from there. So like, let's say they need to get help paying rent so they can stay housed. Then we're going to be asking, are they past due? Are they facing an eviction? Does that make a difference what resources you might send them to? If they have an eviction notice, you might be offering them like legal advice through agencies like Helpline, whatever is appropriate for their area. But we search for the possible resources. We provide that information. That's going to, all about what numbers to call. Can you do this online? What their hours are, what documentation would be needed. And then we also check to see if there are any COVID-19 resources that they might be able to access, like the federal programs like Rent Help MN. So, and as the pandemic has, made all these different transitions over this last 18 months. It's some of the COVID-19 financial assistance programs have closed. So there are less of them that are available. So
Yeah. Well, and that's a question we have in the chat too, with acknowledgement that Rent Help and then did close at the end of January. So for anybody that has a pending application, those applications will continue to be processed, but you're no longer able to put in a new application or a second or follow-up application. So, now that those federal programs may not be accepting applications, how do you help somebody, what other resources are out there besides these federal programs?
well, there can be programs for help with like rent, deposit, mortgage. That can be through the county agency. Then depending on where a caller lives, could be, that there is some local nonprofit that is helping out. They all have their own eligibilities. So you check that eligibility to see if it's possible, because you want to provide them with resources that are potentially viable rather than, you obviously don't want to give somebody a resource that they're not eligible for, because that's just, well, it's not right. And that's not helpful. So that's why we ask all those eligibility questions and things and check with them to see, is this going to fit for your situation?
Yeah. And there's a couple questions around, particular experiences that folks may have. One about citizenship or documentation. And I will say, 211 will serve anyone. We are an anonymous service, confidential. So anybody can call 211 regardless of status. But maybe if you can speak to a bit about some of the challenges or opportunities for folks who might not have documentation. And then there's another question about people who may have had, previously bad experiences with the system, quote unquote, that how, I know those are challenging circumstances, but how do you approach some of those situations with callers?
Yeah, the question about somebody not having documentation, that's a hard one, because most of the agencies do require, they might have an ID, but if they require a social security card, maybe they don't have that. So that's a real challenging call, and you just have to kind of work with them and see what's going on and see if you can find any resources that don't require that kind of documentation. So that's kind of where we go from there. And that all can depend upon, is there something in their area too? Since we deal with it's pretty much the whole state, in rural areas, there aren't as many resources. So that makes it harder. What was the second thing? Second
Folks who
question?
may have had a bad experience with the system, or, maybe somebody doesn't want to go to a shelter for understandable reasons.
Right. Well, that gets to the point, if there's nothing else available but shelter, then it's like, can we brainstorm about it? Let's say we have a situation where the person does have, a pet, and they're living in their car. They do not want to give up their pet. They don't have anybody who can take care of it in the meantime. Then we talk about other options. You might be able to give them like some street outreach programs, so that maybe they can get more survival gear, get contact with other agencies that maybe, social supports and stuff. So, you just try to work with them. And, depending on the situation, it's going to drive where you're going to look for resources.
You and the team do a good job of being creative, and maybe there's not here's a agency that does this specific thing and is ready-made, but trying to really think through different alternatives or combination of things that might help. Yep. Yeah. There is a question in the chat, and maybe Jacky, if you want to take this, go for it. Otherwise, I can elaborate too. But how do we keep up on the programs available and all the time frames and the different requirements? Okay,
that's with our resource staff. So we have resource curators that keep the database up to date. They also look for other resources. If we hear about other resources through our callers, we will let the resource staff know, and then they can check that out and see if that's something we can get in our database. I will have to say that during the pandemic, this has been extremely hard to try to keep up with. You know, I'm always telling callers, call first before you go to see if they're taking walk-ins or not. We do have, you know, the resource staff has done an amazing job, but it is difficult. So, and maybe Julie, you can add to that here.
I think that was a great job. I will
Okay.
add, we reach out directly to agencies whenever possible. We want to get the information from the source. We have a in-depth survey that we send them to provide that information about some of their criteria and their intake process. And, you know, are they located near public transportation lines? All kinds of details that we can provide callers then to be able to relay that information. But yeah, it is an outreach process and multiple people's full-time jobs to keep on top of everything. So Jacky, if you have any examples of somebody maybe you've worked with or talked to that had a success story that you could share, or a somebody who is thankful or appreciative. I know sometimes it can feel heavy, but I know there are some good situations to come out of things too.
Well, actually, I can't think of something right off the top of my head but you know, it is amazing that people call and they are, you know, they're in the midst of all this crisis, and for the most part, everybody is very very appreciative, and they treat you with respect as we treat them with respect. You know, and even if there isn't anything, they will say, thank you for listening to me. Thanks for being there, and I really appreciate what you do. You know, it's really important that when a caller calls that we listen to what they are going through and that we acknowledge what they're going through. And, you know, let them know that they are talking to a human and we do understand what they're going through, and try the best we can to find other resources. And we're always trying to see if they're, I mean, maybe they call for help with the rent, but maybe they need to know their local food shelf. Maybe there's other needs there. And, you know, we try to kind of see if there are other needs we can help them with. So go from there.
Mm-hmm. Great. Thank you so much.
Could you get us started by talking about what are some of the biggest challenges people faced when trying to obtain or maintain stable housing?
Absolutely. I think there are just so many barriers to accessing something so basic that affects all aspects of our lives, housing, right? Our home, where we call home. And so some of the biggest barriers are financial. There's definitely a lot of implicit bias still happening. So, you know, as James was speaking earlier, just, you know, unfortunately, we have a system designed more on keeping people out rather than welcoming in. And I think those play out by way of safety challenges people have. Again, the discrimination, disruptions in life due to violence they may be facing, which disrupts then employment, education, creates legal challenges, but also, again, like I said, financial aspects too. So people who have experienced violence, 99% of them reported have also experienced financial abuse. And then you couple that too with the disparities we already have as it applies to accumulation of wealth. And then these exclusive policies where we really as a society haven't centered housing fully to be accessible, then it's sadly no surprise we see the heavy burden on people already, you know, historically marginalized in our population. So Black and Brown children and families. And all this starts a lot younger, I think, too, than people realize. You know, youth tend to be a little invisible in this. Children populate family shelters in great numbers, and many children have grown up in shelters. And so really, I've worked with people who saying something like, wow, you can have housing. It's like it hasn't even been feeling like that's a reality. It feels like, oh, I'll just only ever be in shelter and shelter to shelter to shelter. And so we really need to look at how we engage people in these, challenges and complex social issues that have really penetrated our society for too long in creative ways, so that housing is centered and a reality and stable, safe housing.
Thanks, Tamara. The complexity of the barriers and the challenges really stick out to me, and Tubman has a really critical role in kind of building hope. And so I wonder, can you just talk a little bit more about the work that you're doing at Tubman that helps folks move towards that hope, towards that housing stability?
Absolutely. So one thing really happy that we have at Tubman is our work in this space has been really co-created with people directly impacted. And so that, I think, is where we want to be at, like listen to what people are going through who are facing these challenges and their proposed solutions, because I think the people we serve are remaining hopeful, have great ideas and wisdom, and then really being able to respond and push things forward in a way that better meets those needs and their amazing strengths. So we have worked in the housing space for decades, in over 20 years, specific in longer term housing, and then have recently built out to longer term housing options through rapid rehousing and scattered site for youth, singles, and families, and specific to people homeless due to violence. And so while we know the impact of violence and other traumas affect everyone's lives, that's also how we work in our service supports to be comprehensive and work in partnership through really dedicated collaborations, so we can generate awareness, but also make the most of what we all have to offer.
Thank you. Can you talk a little bit about how the pandemic has impacted how you're seeing homelessness impact the families that you're serving?
Absolutely. I think the pandemic really laid bare for more people the challenges that were already impacting a lot of people out there, and then it just spread as far as who was impacting. So no surprise, right, on your 211 line, as James recapped, the calls and that is tied to housing, and that really fragile housing. So like if people are already kind of unstably housed, it's like any little thing can throw that off, and they're going to face an episode of homelessness. And a lot of people don't have, we see a lot too where people are trying to make their way if they do have a social support network can help them, but it's I think a lot of times in certain communities, people are renters themselves, and I think renting in itself is you face a little more, it's a little more fragile in general, as opposed to home ownership. So we know that Black, Indigenous, people of color, home ownership rates are lower, and so just that ripple effect of when that path isn't able to be built out as strongly, there's already vulnerabilities. And of course, then the fears about going to shelter too with health conditions, and kind of, it was really beautiful how communities came together to try and do a rapid response as best as possible, yet it's not enough. So I do think, as was discussed earlier, we really need to live into that mindset of abundance and how there's enough for all, and how we create that place that we want to see, that there's enough for everyone.
Your comment about the pandemic laying bare the systematic ways that people end up experiencing homelessness and can sometimes end up getting stuck in that state for a period of time really sticks out to me.
Yeah, and I think there's an idea too that just accessing services is simple, and it's not. So anything we can do to streamline access, to undo the keeping people out, it is really, really powerful. And so, for example, even just, we converted a lot of services to virtual platforms to reduce access barriers, and worked really hard to try and get tech equipment in the hands of people we're serving too, because of course there's still the big tech divide that impacts people's lives as well. So I had a lot of us were really concerned, just like, oh my gosh, what's happening to people who aren't connected with someone out there, who are facing further isolation or just not aware. I mean, it's because even when people are connected with a supportive person who can help navigate, it's still challenging.
Tamara, we have some curiosity in the chat about kind of like, what does that process look like? Where, somebody might start engaging with Tubman with a goal of moving into housing, and what are some of those steps? Like, what are some of the services they might receive?
Absolutely. So as far as housing for us, largely there's a county referral process. So we post what, kind of, and this is required by specific funders, housing and urban development that we have, and then we're required to get match dollars for that. So it does largely go through our county referral partners. So for example, we send like, hey, we're able to serve, youth, our family of this size, and then the county providers will go through who's on the list through the coordinated entry system, and then make a referral back to us that matches that description. And then we start as on the service end of, explaining the program, making sure it's something they're interested in enrolling in. And if so, then we're working with them on a search of affordable housing, meeting the HUD standards. So there's an inspection of the unit that must occur as well to make sure those health and safety standards are met. And then we have a whole range of services that we directly provide. They are voluntary. So that means that people get to kind of select what makes sense for them in their lives. And we're really focused on that trusting rapport with people. A lot of people we're serving, even youth already, have felt like, oh my gosh, who can I trust, right? So establishing that safety, sense of trust, belonging and connections go a really long way. And really being clear about that things can be confusing. We're here to answer questions, do our best to support, and hear about what people's goals, short and longer term aspirations are. And that includes also, a lot of people we serve haven't maybe heard the message of their leaders, and yet they are in many ways, all kinds of ways. And so we like to hear too about how someone might want to get involved on things that directly impacted them, and what they'd like to see different. So that might mean they're speaking out about their experiences, or they're involved in serving on task force or advisory boards, or working to elevate policy changes they'd like to see as well. And that way we do really with a range of partners too.
Those individualized services that Tubman provides is so key to being for individuals and families to be able to move from that experience of homelessness into housing. And I think there's a lot of assumptions in the community about what might lead to homelessness. And if we anchor services in those assumptions, then they can become pretty transactional. And Tubman has been committed since its inception to providing services that are tailored to each individual and each family. And that's really the key across our community with our community partners, where that recognition that everybody's story is unique, and the factors that might have led to a person's experience of homelessness are going to be unique to that family or that individual. And like the leadership that you lift up, gives families the opportunity to make the best decisions for themselves about their next steps.
Absolutely. And the resources to back it, right? That's a lot of our work too. Like really investing. Thank you so much, Jay, for that. And just how we really shift this about, oh, we know best. No, we're helping to facilitate what people want to see in their lives. I have yet to encounter someone who doesn't want the best for themselves and their loved ones.
Tamara, we have a question in the chat about the percentage of homeless individual adults versus families versus youth. Can you speak to that, at least for Tubman?
Yeah, for us, I mean, a lot of that is structured. So we have about half of our population 24 and under, so is youth, homeless due to violence. And then the other half, is over that age. And yet I would definitely, I think anytime looking at statistics around homelessness, even, past years broadly across our state and then comparing it to the country, I think there's a lot of hidden homelessness too. So by that, I mean people who may be staying with others that might not necessarily consider themselves homeless or be counted. And I think certainly when you've got violence in the mix of situations too, that can disrupt things that I've always found it a little backwards. That's often the person who is surviving violence that needs to be, displaced, and how we're really also working to help people who've used violence, change that course and do better and learn better, and how we start early with that. So I know that doesn't give the succinct percentage for the metro or the state. And I would also say a lot of this area is driven by what you all would have heard too a bit earlier. A lot's driven by what we're able to be funded for. So a lot of what you see in those counts are funded programs. So, and there's attempts to capture it more broadly as far as how many are facing it. Yeah, I guess my question sometimes too is, let's just make sure all people are housed. If that's our commitment, how do we live into that? Because and I say that because I been involved in for decades in the trying to, and I know planning needs to be involved as far as how many units for this and that, and we also are going to see what we build for. And so if we're really building for that model of keeping people housed and not building to only committing to short-term shelter, I think we'll make a lot more strides into the future.
You just reminded me that in this field, we often talk about safe and stable housing. We don't just talk about housing, and that safe and stable are key elements in the housing being sustained over a period of time. And so when we're talking about somebody maybe couch hopping or staying in a situation that's not safe, like you said, they're not being counted necessarily as part of the population of people experiencing homelessness, but still that housing may not be safe or stable, which puts people at risk of experiencing homelessness. And that is, part of the work of Greater Twin Cities United Way to do that prevention work so that folks don't end up even having to have that traumatic experience of homelessness.
Absolutely. And we also, one thing we see a lot too is, grandparents out there who are trying to support maybe youth who want to be with their grandparents because some different disruptions have happened with the parents or guardians in their lives. And I think, a lot of times then those grandparents are in senior care facilities or renting themselves and can't accommodate, the grandchild that's interested in. And so we work creatively to support their relationship still, and then the safe, stable housing as well. So that those relationships are so key in safety planning in general.
Absolutely. We have a question in the chat. It's wondering what percentage of the people Tubman sees would you say have been impacted by eviction?
So that the eviction, of course, sadly went up dramatically. As far as who's impacted by eviction in our broad service scope as an agency, it's been like about a 20% increase in people. And so I'm counting people served also by our legal programs that may or may not be in, housing programs with us, also people in our outpatient clinical programs, people we serve in the community, and youth programs. Of course, we do work to fundraise to, if other, services out there for financial support to prevent eviction aren't available. We do work to do what we can to offset those evictions, but certainly the call lines. So those are people not necessarily, we have a resource line as well. And so if we haven't been directly working with people, there are then a lot of calls very similar to the breakdown you have about rent assistance resources.
What sort of wait times to find safe and stable housing? What does that look like?
My goodness, thank you for that. Thank you for all these questions. And that one, I think there is this idea too that yes, okay, someone is through this process and there we go, affordable housing. And it's it can be about a 3 to 6 month, search time, 6 at the longest of it, even with assistance. And that's, so fortunately we have lots of different property managers engaged and committed to serving and reducing those access barriers. Yet there are still access barriers. We're serving people who may not have that rental history or have unlawful detainers or have a criminal history as well, and overcoming those barriers. And so and then the safety, what neighborhoods are regarded as safe for a person too is really key.
Thank you so much for sharing with us about the work of Tubman. With our last minute here, maybe you could speak to this last question. Other than money, what is other important resources in disrupting homelessness in the region?
Beautiful. So I'm a personal fan of housing first models. I think like the policy changes, if you look, if people haven't but are curious and looking at the history of homelessness in our country, it really was rooted by design in policies to exclude. And so by identifying that, we know we can undo it as well. And so I think that is something beyond the financial. Of course, financial can't separate race and economics is what I was always taught. And I see that also play out in who is facing homelessness at larger rates. And so I think there's a lot to be done just at that policy angle to simplify and to really root in a practice and investment of housing first for people.
Thank you for your just incredible responses to these questions, Tamara. The work of Tubman is so deep and incredible, and your reach and impact is really clear. Any final words about kind of homeless response in our region, or about your work that you want to share with this group?
Yeah, it's really, our work isn't possible without great invested partners too, willing to take kind of bold steps towards change. And so I really thank Greater Twin Cities United Way for that, and so many others. And I think just the more we grow in that area with our shared commitment to truly ending homelessness, people do thrive.
Thank you again to Jacky and Tamara for sharing your stories and sharing the details about the work you do and really bringing it to life. One of the things that we wanted to, as we end some of our time together today, to share, to reflect on, is we probably talked a lot today about need. We talked a lot about what we don't have. We talked a lot about crisis, right? All rooted in the importance of having a place to call home, right? Having a place to, safe, warm place to sleep at night. But Tamara and Jacky, as you do your work and as you reflect on what we've been through as a community these last 18 months and think about the future as we end our time together today. What gives you hope?
I'm happy to share. I have great hope in humanity, right? So I think, like, for me, I'm constantly inspired by people and their ideas and what they've overcome and how much they do care. And so I'm reminded of how we, get more of what we notice too. And so always hopeful in making sure to notice those bright spots, the positive things working well, and how do we grow and spread that? And that's not to ignore challenges, but to help overcome them by recognizing our own humanity, things that we've been through in our lives and who was there and what worked well for us, and doing so without shame and judgment.
No, actually, I was just taking a note when you said get more of what we notice. I wrote that down. I wrote that down because I agree with what you said there. Get more of what we notice, and especially centering on that shared humanity. And Jacky, you've had countless conversations with people over the course of your time at 211. And I'm sure there are some stories that have stuck with you, right? That you remember and you maybe reflect on as you think about the future. What gives you hope in the work that you do and how we interact with folks experiencing need?
Well, I guess it gives me hope that, that people can be so kind and generous in the midst of their own crisis, that they're, and that people will call and they've found somebody who is homeless on the street or in a coffee shop, and they've fed them and they're looking for shelter resources for them. So to hear that other people are like stepping up and trying to help, gives you hope too, especially with everything that's gone on with the pandemic and the riots and everything, that people are still out there trying to help. And a lot of the callers that I have, it's not them that's in crisis, but they're calling for a family member. They're calling for somebody they met at the laundromat, and they're trying to reach out and help. So it's just amazing. So
thank you for sharing that, Jacky. And I think that message of really is why we're all here today, right? That message of people want to help, right? I think all of the 50-some participants in today's call, we're all here because we want to help and we want to do good by our community, but not only do good, but do better, right? And so thank you both for the work that you do with our callers, with people seeking services for themselves and for people they care about, and really creating a community that we're proud of, that we're proud to call home. And so, as I reflect on what gives me hope, and I've shared this with the team, on 480,000 interactions last year, and I talk to the team regularly about what they're learning, what they're hearing, what insights can we gather, because I want to communicate these insights to people that can use it to make a difference. And what brings me hope is again that people want to talk to people because we care about people, right? And that really that focusing on that shared humanity, which again I think is why we're here today, why United Way exists, why Tubman exists, and what gives us hope for tomorrow. So thank you all for being here, and Kristen.
Yeah, thanks so much, James. I appreciate that. A huge thank you to Jacky and Tamara, and also for Julie and Jay for moving these conversations. But it's clear that, your work is so inspiring. It's so important. It's just so critical, and your passion really shines through. And what gives me hope is that we're all here today. We're all concerned and about this issue. We're curious to learn more. We're passionate and spending our time and energy to come together to address these really complex issues. So if you're so inspired, I really invite you to put why you're hopeful in the chat. I think when we talk about heavy topics like this, we have to know that we're making good progress and we're working hard and working with people and with each other. So I invite you to do that. And one way that obviously we can do that is to work together, right? We can donate. Always, need support, financial support to do the work we do with the partners like Tamara at Tubman, to host a very large 211 team that's fielding almost, 500,000 calls a year is unimaginable. To advocate, I work, that's a lot of the work that I lead, but advocating for policy and systems change at the Capitol is really important. We invite you to join our advocacy network. There's the website there. You can learn about events that are coming up, sign up, register, and join the work that we are engaging in at the Capitol. Please, you're welcome. We have several giving communities where we can connect people that really have a passion in a certain area or a common network. You can join there. And then also, we're always looking for great volunteers. So we look forward to seeing you all in the future here. We will be sharing information on our website as we always do. This, as you know, this event is recorded, so that will be on our website. You can find that later, probably next week. Those usually go up, and you can find out more information as always by going to our website. As we wrap up our today's session, I just want to share a commitment to live inclusively. I think this is important and a great way to close out our conversation today, and I'll share that with you now. I commit to be intentional in living inclusively. I commit to spending more time getting to know myself and understanding my culture. In understanding myself, I am better positioned to understand others. And I acknowledge that I don't know what I don't know, but I'll use not use what is unconscious as an excuse. We obviously see quite a bit of that going on. I will be intentional in exposing myself to different opportunities. If I don't know, I will ask. If I'm asked, I will ask questions and assume positive intent. Most importantly, I will accept responsibility in increasing my own knowledge of understanding. I commit to speaking up and speaking out, even when I'm not directly impacted, for there is no thing as neutrality in the quest for equity, justice, and inclusion. I will strive to accept and not just tolerate, respect, even if I don't agree, and be curious, not judgmental. I commit to pausing and listening. I will be empathetic to the experiences and perspectives of my others, and I will use my privilege positively and get comfortable with my own discomfort. I commit to knowing, getting, and doing better than I did yesterday, keeping in mind my commitment to live inclusively is a journey and not a destination. So with that, I'd like to thank all of you attending today's session and have a wonderful afternoon. Thank you so much.